Typically, if you have symptoms, it's in the later stages of the valve disease. So a lot of times it's picked up by the family doctor because he hears an extra sound called a murmur. And so he'll hear that sound, and then they'll send them for an echocardiogram, and then they'll start following them. And if they meet the criteria, then they will typically confer with a cardiologist. And so, but a lot of times it's picked up from hearing a murmur or an extra sound.
Yeah, our focus has always been to encourage patients to get their valve disease treated early, and encourage family doctors to refer patients to a cardiologist early for valve disease. The current criteria for mitral valve replacement and repair really encourage patients to get these procedures done even when they're asymptomatic, because the earlier it's done, the more likely a repair can be done rather than a replacement. And the patient can have one procedure definitively performed that lasts them the rest of their life, that requires no further anticoagulation. The heart is as strong as it ever has been, and they'll have the highest quality of life for their remaining years. If the patient is delayed in receiving therapy until the heart is already weak, the heart doesn't get stronger again after you replace the valve. It stays weak. So early treatment is the cornerstone of therapy for valve disease, now according to the American College of Cardiology. The problem with valve disease and the diagnosis of valve disease is that there's no typical patient. There are no lifestyle choices that predispose to valve disease, and genetics only plays a small role. Some people know from birth they have a murmur, which is the extra sound that is heard with the stethoscope. Those people should have regular checkups with the cardiologist throughout their lives, because eventually they may need a valve replacement. But other than that, the symptoms come on insidiously. They're often mistaken for just getting old. They may or may not be accompanied by a murmur that can be heard by the family doctor. So patients may end up presenting late, but the point is that the hallmark, I think, of valve disease is easy fatigability and shortness of breath. Less so than chest pain. It's easy fatigability and shortness of breath. And if a person begins to experience easy fatigability and shortness of breath before they really think they should, given their level of exercise and their age, they really should get that checked out.
Well, you start by talking to your family doctor. And if they hear an extra sound, or a lot of times they'll go ahead and order an echocardiogram. Probably an EKG, which you have to put the leads on your chest, and an echocardiogram. And the echocardiogram is a very good tool to really get a good look at the heart valves and see if there's a problem.
I agree. The definitive test for valve disease is the echocardiogram. It will say with almost 100% certainty whether or not the disease exists.